Hi everyone, my name is Noor and I'm majoring in public health.
My name is Ranjit. I'm majoring in health service management.
My name is Kwabna. I'm majoring in public health.
And finally, this is Hassan, and I'm a student of public health as well. In our today's discussion, as you all know, we are going to visualize and describe the health disparity existing in two groups of people, namely the Wadeye community of Northern Territory and indigenous Australian population group, and the Lebanese community in the city of Moreland, Canberra, a culturally and linguistically diverse group.
The Wadeye population is one of the biggest indigenous populations that live in the Northern Territory. They are located on the coast of the state with approximately 20 to 80 residents. Their general health care needs include general health checkups, mental health and social workers, food suppliers close to the community, clean water supply, education for younger children, and housing. The reasoning behind these health needs include a large amount of the male community, being 80 to 90%, are cannabis users, in which the long-term effect of cannabis use is mental illnesses. And this community needs a big food supply that is close because it is located in a rural area with a small population. Education is also needed for younger children that will learn and be trained in substance abuse, as well as its effects it has on an individual and their family. This population also needs health checkups because access to healthcare is not done so oftenly, so it is important to check for any risk and complications.
Exactly. And in addition to that, an estimated 11% of the 2,280 people in the community are affected by chronic diseases. According to the Australian Institute of Health and Welfare, chronic lung diseases make up 30% of all chronic diseases, followed by chronic kidney diseases 18% and cardiovascular diseases 13.6%. You know, these values are significantly higher than non-Indigenous population groups. Smoking and drug addiction has been described by the National Australian Indigenous Agency 2020 as the main culprit behind these escalating rates of chronic diseases, and that's why these two health issues are the focus of our presentation today.
There are many historical factors that have impacted the health of the Wadeye population till today. Some of these include colonisation, which has resulted in racism and inequality, including the disruption of Aboriginal communities in Northern Territory. There is a long history of violence and gang eruptions that brought fear to many residents and their access to health services. In the late 1990s and early 2000s, there was a high incidence rate of infectious diseases that was caused by many overcrowded homes, access to affordable and healthy foods, housing authorities. Until community homes were created, many families lived in the outback, but there still remains many overcrowded homes. There is a long history of racism and police brutality in the remote town, which still exists today. The experiences of the Wadeye population are difficult to pinpoint. However, there is a tendency to downplay the risk of cannabis use through the media and statistics, so there is limited awareness. Cannabis use is not believed to be harmful, and due to this, health services experiences are quite rare. Levels of substance abuse in remote communities place a huge burden on health services that do exist, effectively reducing the availability of treatment for other medical needs in the community. This results in expectancies being reduced to the point where there is a reduced pool of people to provide leadership in the community. There is very limited housing in this community, which results in overcrowding. Cultural awareness in health institutions is very low, which means that the targeted population group is not encouraged to adopt health-seeking behaviours. There is only one main health centre in Wadeye with access times only available during the day and during the weekdays, making it difficult for health professionals to opt for client-centered practices.
I will move on to the Lebanese population in Canberra, mainly Moreland. So the health needs of this population is therapists, mental workers, and social workers, as well as aged care workers. We should be also providing oral health services. So the reason behind the need for all these services is that the population often has tobacco smoking problems. So daily smoking is a big thing amongst the community of Lebanese people in that area. There's about 45% of ages 25 to 64 not engaging in physical activity. Also, in addition to that, there is insufficient healthy diet practices. All of this is an amalgamation of traumatic experiences, mental health issues. So this comes from a lack of understanding and general well-being, and it's a result of past traumas experienced by the population. This has led to drug and substance abuse, hence the higher rates of alcoholism and smoking. The lack of mental health literacy is directly linked to the substance abuse, PTSD, alcoholism, and smoking. Although the community may be aware of the dangers of smoking and alcoholism, there's little to no effort to self-educate or educate the community at large due to the negative stigma attached to mental health. As we know, mental health is part of our biomedical model of health and plays a huge role in patient self-efficacy. Providing education and support through health services such as psychologists, therapists, and social workers will greatly benefit the community and lead to positive health outcomes. So the experiences of this secondary population, so our Lebanese community, is that due to a lack of mental health literacy, mental health might not be taken as seriously. There's a tendency to downplay health complications until much later when they're more detrimental to the overall health of the person. And there's also concerns regarding the confidentiality and mistrust as well between patient and doctor or health professional. Another experience is that there is gender-based roles. So the men in the community often are the ones speaking up on behalf of the woman in the community. And this is irrespective of religious views and more of a cultural barrier thing. All right, I've already talked about the lack of trust. So next one.
Yes, in fact, if you go to the next slide, you can see that there are a lot of similarities in the health experiences of this cult group and the indigenous Wadeye community. Just like the Wadeye people, the Lebanese migrant community has a history of oppression in their home country and were driven out by a civil war. The history of political and social dislocation in Lebanon has given the immigrants a poor start in Australia. Due to lack of education, just like the Wadeye community, this cult group has poor health literacy, leading to less effective communication with health professionals. Along with this, language barriers, lack of knowledge about accessing healthcare services, and high cost of medication has played a vital role in poor medical adherence within this community. And then things like labeling, discrimination, stereotyping, racism, these things are also widely prevalent, which fuel the perception that Anglo-Saxon health professionals are unfriendly or unreliable. When such distrust is prevalent, sexual and drug addiction problems are not easily communicated to the health professionals. However, there are differences between the health experiences of these two communities. For the Wadeye community, health is a holistic concept that includes social, mental, physical, emotional, cultural, ecological, etc. well-being. However, the Lebanese community's perception of health is more closely related to the Western biomedical model. So therefore, communicating with Western health professionals is quite easier for them compared to the Wadeye people. Moreover, having a nearly white skin color also gives them a racial advantage in the anglicized healthcare systems. Now let's discuss a bit about the clinical and professional expertise needed to meet the health needs of both population groups. I think communication is a very important tool in establishing a trust-based therapeutic relationship, especially with disadvantaged people like cult and indigenous communities. Assertive communication techniques have been shown in research to increase patient satisfaction and adherence. This can be achieved by a friendly tone of communication, active listening, using normal language rather than professional jargons, and improving thorough conversation with the patient. Empathy and cultural sensitivity are two other skills that can help health professionals meet the needs of diverse population groups. Empathy can be established by shared decision-making with patients and withholding any judgment. Cultural sensitivity, on the other hand, can be promoted by overcoming language barriers through a bilingual system with professional interpreters.
Right. So as Don has stated, it is the same for the Lebanese community. So there is a need for communication skills amongst health professionals to develop that rapport and to meet their needs as well. Also organizational policies and procedures, teamwork amongst health professionals to achieve a positive health outcomes, time management, stress management, that's for both health professionals and patients, and also attentiveness to detail.
Right, and the skills that needed to meet the needs of a Wadeye population in relation to the health service management discipline include building a strength-based approach which focuses on an individual's self-determination and strengths, need more creative and innovative thinking about different communities among staff, promoting better business performance and productivity, developing workplace policies and training that promote cross-cultural awareness. Additionally, the clinical skills needed to meet the needs of secondary population group includes multidisciplinary care when professionals from a range of disciplines work together to deliver comprehensive care that addresses as many of the patient's needs as possible. Working with management to identify safety problems and find solutions. Identify the potential impact of cultural factors on service delivery to the community. And last, communication strategies that showing respect for the diversity in communication with all people.
The health strategy associated with the public health discipline is done in many steps. The goal is to improve the health and well-being of the Aboriginal population in Wadeye by preventing and reducing harmful effects of drug use, as well as smoking. This is done by collaborating with indigenous elders and appointed leaders to ensure the strategy is done with their approval, increasing access to and from appropriate prevention programs and interventions, attempting to strengthen partnerships between these organisations and law enforcement, which is critical to raising the health and well-being of the prosperity of the Aboriginal and Torres Strait Islander communities, in communities to play an active role in addressing local liquor licensing issues, holding regular health checkups and mental health checkups, a total alcohol ban, ensuring that policy initiatives are supported by community elders and leaders, and finally, to balance the talking with the doing, implementation in the past has caused way too much community consultation, and talking paired with failure to follow through with the action has led to disbelief and distrust.
Okay, Clover, can you go back on the slide? Thank you. The health strategy proposed in accordance to health service management practices and policies ensures a culturally competent system that provides community-specific services to Indigenous Australians. In addition to Noor's statement, the employment of Indigenous Australians in the workplace should be increased along with the training of culturally competent non-Indigenous persons for the betterment of vulnerable communities of people. More specifically, training should be provided on how to build a therapeutic relationship as a means of building rapport with Indigenous Australians and healthcare workers. This allows Indigenous Australians to gain confidence when accessing healthcare services, leading to positive health outcomes.
However, certain adaptations need to be made when public health strategies are applied to the Lebanese community of Moreland. For this community of people, the public health strategies could be more focused towards increasing health literacy about the harmful effects of drugs and cigarettes. This is because smoking cigarettes and shisha and taking drugs like cannabis has been normalized in their culture, and most people are not even aware of their harmful effects. Therefore, children in schools and colleges should be made aware of the health risks associated with consuming these products by including them in the curriculum. Fear-based messages can be displayed on national media that depict detrimental effects like lung cancer and kidney damage. Motivational interviewing can be carried out on smokers and people with drug addiction problems to increase awareness.
From a health service perspective, there is also a need for adaptations to be disclosed when strategies are applied to the Lebanese community of Moreland. For this group, community-oriented strategies should be used for community services, and the participation of community members should be utilized in the development and implementation of service-level interventions. Council should provide services, programs, advice, facilities, and support to meet the needs of the Moreland community. In addition, they can provide open work opportunity for the Lebanese community in health service programs or projects. All right, thank you for your attention. Have a good day.
Bye, everyone. See you.